Hello, and welcome to Caregivers First, the show brought to you by SCAN, Social Community Activities Network, the organization dedicated to helping active adults stay informed, empowered, and inspired. My name is Lavelle Jones. I'm delighted to be your host. We have a great show for you. Let's get started. The COVID-19 pandemic has changed our world, our country, and our state in ways we couldn't have imagined. Caregivers face unique challenges. They must care for their loved ones in isolation. They're concerned about layoffs and furloughs, and they want to keep themselves and their loved ones safe. So today, we're going to discuss advocacy and legislation that can help caregivers navigate these uncharted waters. My guest today is Crystal McDonald. Crystal is the Associate State Director of Advocacy for AARP New Jersey, where she helps to plan and execute campaigns to support family caregivers, improve healthcare access and affordability, promote retirement security, and ensure access to affordable utilities. Crystal brings over 10 years' experience in community organizing, health policy, and coalition building. Welcome to the show, Crystal.
Thanks, Lavelle. I'm happy to be here.
Thank you so much for joining us. I'd like to start our discussion today with a basic question. In your role, you are working on behalf of New Jerseyans who are 50 years and older. How does your work benefit caregivers, and why is advocacy awareness important to them?
A great question, Lavelle. And so many of you know about AARP already, and our mission is to help people 50 plus live the lives they choose as they age. And we have a saying within AARP that what we do for all. And that's really because everything that benefits people 50 and over really benefits everyone else, either directly or indirectly. And caregiving is a cornerstone of the work that we do. There are over 1.3 million caregivers in the state of New Jersey who provide over $13 billion in unpaid care. And these caregivers are helping their loved ones to stay home where they want to be. They're also helping the state by alleviating some of the burden and costs associated with long-term caregiving. And so it's incredibly important that we support our family caregivers, make sure that they know what protections and supports they're entitled to, especially during this time of public health emergency.
Thank you, Crystal. That makes a lot of sense. I'd like to talk now about nursing homes and long-term care facilities. As we all know, the COVID-19 pandemic has hit them hard. There are also questions about transparency in nursing homes regarding the health status of their residents. So would you tell us, what is the situation in New Jersey with nursing homes, and what do caregivers need to know if they have loved ones in these facilities?
So Lavelle, this really has been a tragic, large part of the public health crisis. Too many nursing home residents and staff have died from COVID-19. Over 50% at this point of the deaths in our state have been residents of long-term care facilities. And ensuring the safety and transparency at our nursing homes and long-term care facilities is a huge priority for AARP. We've been advocating at the state and federal level to ensure transparent reporting, communication between the facility and family members, making sure that our loved ones who are in long-term care facilities aren't feeling completely isolated since they can't have visitors now, by making sure that there's virtual visitation allowed between the residents and their loved ones, making sure that there's adequate PPE, which is personal protective equipment, available for the staff so that they can take care of residents without infecting them or vice versa, and making sure that there's enough testing. Make sure we test the staff and residents to try to stop the spread of COVID-19, and of course, making sure that we're strengthening staffing.
Crystal, if I may, let me just ask you one question, because
Sure.
I am asked this often by my own friends and relatives. When we say PPE, what exactly are we referring to?
So personal protective equipment is things like making sure that they have N95 masks, proper gowns, gloves, and all kind of the equipment to make sure that any parts of the virus that could be spread, transmitted, through the air or touch or things like that, that they're covered and protected from that, and also protected from spreading it to others.
Okay, great. Thank you.
You're welcome. This has been an incredibly important issue. We've been advocating in New Jersey and across the country on this, both on the state and federal level. And our advocacy has been yielding some results. So New Jersey is now reporting daily the impact of COVID-19 at all of our nursing homes and assisted living facilities. The state has expanded to universal testing at all long-term care facilities for both residents and staff. And we've also called in, as a state, the National Guard to assist with staffing needs at our long-term care facilities. Then on the federal level, we've met with all of our New Jersey members of Congress, and this was a great effort on behalf of AARP volunteers and staff across the state to make sure that in Congress, they're fighting for all of us at the federal level, making sure that we have that personal protective equipment, making sure that there's funding to support the needs we have back at home. And if you'd like more information on that, people can visit aarp.org/nursing homes. Again, that's aarp.org/nursing homes. And while there's still a ton of work to do to advocate to make sure that we respond in this moment to this crisis, and then of course make sure that we are rectifying any problems there are so that we don't run into the same problem in the future, we also have additional resources for people right now who are asking, well, what do I do if my loved one is in a nursing home?
Yes.
And so AARP has this wonderful resource. It's called AARP's 6 Questions You Should Ask if a loved one is in a nursing home. Very clever, right? So it's really just a helpful guide to say, well, what should you do and how do you make the decision? And so the 6 questions I'll share with you. Number 1, has anyone in the nursing home tested positive for COVID-19?
Okay, may I ask you a question
Sure.
just about that? Because in my own family and also with a couple of my friends, we have encountered situations where the question has been asked, but it hasn't been answered. So are these facilities required to answer the question about the incidence of the virus within their facilities?
Yes, the facilities are required to answer that question. There is public daily reporting now that's put out on the Department of Health website on which long-term care facilities have COVID-19 infections and how many deaths there have been in the facility. And the type of information that they're sharing continues to grow. So by the time this airs, there will probably be much more information than there is available today. But the facilities are supposed to be communicating with families of the residents to let them know what the situation is in the facility. We have heard that that is not happening in all cases, and AARP has been fighting very hard to make sure that that kind of transparent sharing of information is adhered to for all facilities.
Okay, great.
But it's a good question, and not something that's happening just in New Jersey, but we're hearing in many other states as well. But that is your first question, and hopefully you are being able to get that answer now that this is airing. Yes. And then second is, what is the nursing home doing to prevent infections? And so there are a lot of ways that they are supposed to be tackling this, things like cohorting and separating out infected patients versus patients who do not have the virus. Do they have enough PPE? Or, again, personal protective equipment for the staff, and do they have enough staffing? And if not, has the National Guard been called in to help with staffing issues there? Third, kind of gets into more of that personal protective equipment, but do all the staff there have personal protective equipment? Things like, again, the masks, face shields, gowns, gloves that they need to keep themselves safe, because the staff also don't want to contract this virus, and to keep the patients safe. The fourth is, what is the nursing home doing to help residents stay connected with their families or loved ones at this time? And so just because you can't be physically there to visit your loved one does not mean that they shouldn't have contact with the outside world. And so we want to make sure that at the facilities there is the possibility of doing virtual visitation regularly with the residents and their loved ones, and that they have the support, both technological and physical connecting with the video phones, regular phones that they need.
And when you say virtual visitations, are you talking about needing computers to or iPhones to FaceTime, or just phone calls, or all of the above?
I'd say all of the above. Virtual visitation is going to look different for every resident. They'll all have different needs based on their own capabilities, and it could mean using a tablet or iPad to do FaceTime. Could be a web chat, how we're doing right now. Others might prefer a telephone or some other type of communication. And so it can look a lot of different ways, but it should be up to the resident how they want to communicate with their loved one.
Okay, that's great. Thank you.
You're welcome. And then I would say within that too, certain residents are going to have different needs. A patient with dementia or some other kind of chronic disease might need a different way to facilitate having a conversation with their loved one. And so the facility really should have the staff and the appropriate technological equipment to be able to ensure that those folks can communicate with their loved ones. And then where am I? I'm number
5?
Number 5, thank you. So number 5, what is the plan for the nursing home to communicate important information to both residents and families on a regular basis? And so you pointed to this in our conversation. We need to make sure that communication is a two-way street. We've heard many stories of families who've called to the facility and found that they couldn't get in touch with their loved one, or they found that they couldn't get in touch with someone who could tell them what's happening,
yes,
on the ground there. Have there been cases? Are they moving patients? And so this is something that the state is actively working on, that the facilities should be working on, and we need to make sure that there's daily conversation and a mechanism for making sure that families aren't in the dark and unable to find out, what the situation is at the long-term care facility. And then 6, is the nursing home currently at full staffing levels for nurses, aides, and other workers? And so throughout this crisis, making sure that we have enough healthcare workers across the board, not just in long-term care facilities, has been incredibly important. But as the number of cases have risen so dramatically in our long-term care facilities, it has been, continues to be, and will be in the future, very important to ensure that long-term care facilities have all of the staff that they need to care for the residents there. They are relying on them to make sure that our loved ones are safe and cared for in that space. And that means nursing staff, that means nurses, aides. It also means making sure that they're eating, bathing, and getting other proper care. And of course, being able to communicate with their loved ones virtually. So going through all of this list will help you as a caregiver to assess, okay, what do I have all the information I need about what's happening in the long-term care facility, and help you to make a decision about what's going to work best for you and your family.
Terrific.
So, yeah.
That is just excellent information. I wish I had had those 6 questions a couple of months ago, but it's very valuable information. Thank you so much, Crystal. We are going to stop now and take a brief pause. And when we come back, we will continue our discussion with Crystal McDonald of AARP New Jersey.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At CareOne, you'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
I am having a wonderful discussion today with Crystal McDonald from AARP New Jersey. And before the break, we were talking about the 6 questions that we can ask nursing homes if we have loved ones who are in those facilities. And so, Crystal, I'd like to just double back to that because I know that you have an important piece of information that you'd like to share with our audience if they have any questions about these nursing home facilities.
Yes, I just want to share that we do have in New Jersey a long-term care ombudswoman whose job is really to help anyone who's having any concerns about safety of their loved ones in long-term care facilities. So if you are concerned about the safety of your loved one or who is in a long-term care facility, you should reach out to the New Jersey Long-Term Care Ombudswoman. They have a phone number and email address, which I'll give to you, giving you time to get a pen. It's 1-877-582-6995. Again, that's 1-877-582-6995. Or you can email at ombudsman@ltco.nj.gov. Again, that's ombudsman, OMBUDSMAN at ltco.nj.gov.
Great. Thank you so much for giving us that information.
Of course.
Now, let's move on to a different topic if we could. And I would like to talk a little bit about one of the latest pieces of legislation that's been enacted here in New Jersey, and that involves telehealth. Telehealth, as I understand it, makes it safer and easier for patients to receive care. So if you would please walk us through what telehealth is and describe the New Jersey law that expands telemedicine during the COVID-19 pandemic.
Of course. So telehealth is really the ability to connect remotely with a healthcare provider in real time. So it's often over video. Sometimes you can do it by telephone, email. Your doctor might have an online patient portal. But the goal is to help you manage you or your loved one's health and well-being over distances so that you don't have to be there in person necessarily. So it's not a unique medical service, but it's an innovative way for providers to help deliver care to patients without a face-to-face visit. And so the benefits are really enormous, especially during this public health crisis. But even outside of this crisis, just think about how long you spend getting ready to go to the doctor's office, sitting in the waiting room with all of those other patients who may or may not be ill, until you finally get in with your provider. And so this, at a minimum, helps to eliminate a lot of wait time, but certainly now more than ever, provides a much safer way to get in front of a provider. It also helps with making sure that you're, as a caregiver or someone who needs a caregiver, for them to be able to be at the appointment with you. So they don't, as a caregiver, you don't have to leave work to be with your loved one necessarily. There's ways for you to video conference in, and a great way to have someone be a second set of ears in your doctor's visit. So even prior to the pandemic, AARP has advocated for improved access to telehealth, really for those reasons. It helps to relieve wait times for doctor's appointments, it improves access, and allows family caregivers to be there for loved ones without having to really inconvenience what else they've got going on in that day. in response to the coronavirus pandemic, at the federal level, Congress and the administration have made it easier for seniors to access telehealth by allowing Medicare to cover telehealth checkups, broaden the list of services that can be provided by telehealth, and lifted restrictions so that people can utilize telehealth in their homes. And so a lot of the advocacy that we do is around making sure that it is accessible, and that barriers like you have to be in another provider's office to talk to, your specialist, that you can just do those kinds of things at home, and that you can access it through whatever insurance you have. Here in New Jersey, Governor Murphy has enacted a law that requires Medicaid and private health insurance plans to provide telehealth during the COVID-19 state of emergency. So it is kind of limited right now to this pandemic, but access to telehealth really can help reduce the need for family caregivers and their loved ones to have to travel to and from the doctor's office. It helps keep people out of waiting rooms when they don't need to be there, and make sure that you still have access to all of the medical support and advice that you need. If you'd like more information on telehealth, you can find it on our website at aarp.org/coronavirus. Again, that's aarp.org/coronavirus. And actually at that website, you'll find a ton of other information as well, but certainly you can find more on telehealth.
That is terrific. And I will attest to the usefulness of telemedicine. I actually used it for the first time myself last year. I had a sprain, and rather than going into my doctor's office, I was able to contact a doctor through my health insurance, and I described my symptoms, actually showed them via my computer, and received a prescription, and it was great. So I'm very happy that access has been extended to people during this pandemic, because I think it helps all of us stay a little bit safer. The less we have to go outside, the better it is. So thank you very much for that information.
No problem.
Let's go on. I've got another question, and this one is related to caregivers as they try to find that new normal in these unprecedented times. Many of the previous supports available to caregivers aren't there, whether it's temporarily or permanently, things such as adult daycare and respite care, etc. So what resources are available right now for family caregivers?
So this is obviously a hugely difficult time for many people, especially for family caregivers. AARP does have some resources and recommendations for folks who are trying to navigate this new normal, as you said. I guess I'll share some of those resources with you now. So there is a COVID-19 caregiver checklist that's up on our website. It's in English and in Spanish. You can find it at aarp.org/NJ caregiving. Again, it's aarp.org/NJ caregiving. And it's really to help caregivers think about how do you prepare for this public health emergency. And so certainly now, it'll be helpful if you're preparing for hopefully not another, but if we have another wave of the coronavirus, to help you prepare in that moment. And there are really 5 main things to think about. One is pulling together your team. And you do this anyway as a caregiver, but who can help you during this pandemic to care for your loved one? Is it you and a family member, a neighbor, someone else close to your loved one? But who is that team? And make sure you're all aware you're on that team together, and know how you're supporting each other. 2 is to inventory essential items. So do you have enough supplies for your loved one for the next few weeks or month? Do they have food, water, toiletries, all of those items that you really need to be able to stay home? And of course, number 3 on that list is to make sure you have extra medications. So as much as possible, you want to make sure you have at least a 30-day supply of the medications that your loved one needs, so that they can remain at home. And then 4 is to create a plan to stay connected. And especially as caregivers, it's incredibly difficult to not feel isolated even when it's not a pandemic. So making sure that you have a plan to stay connected with your loved one that you're caring for, but also to make sure that you are not isolated as well and that you are caring for yourself. And then number 5 is to maintain personal safety and, again, that self-care. So if your loved one that you're caring for needs regular care, you might want to consider self-isolating with the loved one that you're taking care of. And again, making sure that you have time to take care of your own medical and personal needs in addition to caring for your loved one. So there's much more detail on the checklist. I suggest taking a look at it. But I would say, in addition to all that now more than ever, it's important to stay connected with your loved ones and really to try to fight back against the impacts of social isolation. So it's a real thing, right? Humans are not made to be by themselves in a bubble for months at a time. And it's normal to start to feel not just lonely, but really isolated, which is, kind of something you feel much deeper and really can impact your mental health. And so you want to make sure that you're checking in with your loved ones, whether it be by phone, email, FaceTime. I've had a lot of people tell me they don't want to talk to me via video chat because their roots are growing out. So if that's the case, that's fine. But let's email. Let's be on the phone and check in with each other to make sure that you're still connecting with people in the outside world. Make sure that you develop a plan to stay safely regular in touch. Sometimes there's a weekly game night. I've heard folks having kind of their weekly happy hours with loved ones, in some cases seeing different generations all on one call. I know a lot of my family members have just started using FaceTime for the first time, or Skype or Zoom meetings, and so there can be some fun to be had, and making sure that you're reaching out to any loved ones who you're not hearing from as well. So maybe they're, maybe they are feeling really isolated and have shut themselves in a little bit. So take the extra time to try to reach out to those ones that you care about too, who might be hiding their roots and the rest of themselves during the pandemic. And for anyone who just wants to hear a friendly voice, and maybe it's you don't have anyone to give you a call, or that you don't have anyone to call yourself, or you just don't feel like FaceTiming with your family members, again, there is AARP Community Connections has a toll-free friendly voice phone call, so that you can receive a call from an AARP trained volunteer just to chat and say hello, talk about how things are going. And so you can request a phone call to leave your information, and they'll call you back. There's an English and Spanish. So the English number is 888-281-0145. Again, that's 888-281-0145. And if you'd like a call in Spanish, you can reach out to 1-888-497-4108. Again, for a Spanish-friendly voice call, you can reach out to 888-497-4108.
That is terrific. Thank you so much, Crystal, for that information. It is amazing how quickly our time goes on this show, and we only have about a minute left, but I wanted to ask you if there is any other message that you would like to give to the caregivers and all of the viewers who are with us today.
So I would say it's an incredibly difficult time, and it's a time when we are all being called to step up in ways that we have never been before, and a time where we're also being able to kind of reflect in at ourselves and what we're doing. But you have to stay connected to your loved ones. You've got to stay connected and take care of yourself. But I would like to give 2 resources that I think will be helpful for you to find more information. And so all of our general information about coronavirus at AARP is on our website. It's at aarp.org/coronavirus. And that website will take you to a plethora of information, from everything on telehealth to how to prepare to care for a loved one during this pandemic, to what resources are available for financial relief for working family caregivers, for example. So again, that's www.aarp.org/coronavirus. And then you can
Terrific.
also,
No,
reach
no, no,
out
I'm
to,
saying that's terrific. Yeah.
there's also more information about our advocacy work at AARP New Jersey on caregiving, and that's at aarp.org/NJ caregiving. Again, that's aarp.org/NJ caregiving.
Thank you so much, Crystal. This has been just a wealth of information. We really appreciate your sharing your time with us today, and thank you for all that you are doing. I do hope that you will join us for the next edition of Caregivers First. Until then, stay safe and take care.